Gloria Ramirez was only 31 years old when she became the center of one of the most baffling medical mysteries ever recorded. On the evening of February 19, 1994, she arrived at Riverside General Hospital in California, struggling to breathe and in extreme pain. Her body was failing her. She had been battling advanced cervical cancer, and now her time was running out. As paramedics wheeled her into the emergency room, the medical staff prepared for what they thought would be a straightforward case of advanced cancer complications. But nothing about that night would be ordinary. What happened in that hospital room would leave doctors, nurses, and scientists puzzled for decades. Doctors administered sedatives and drew blood to calm her rapid heart rate. Almost immediately, something strange happened. One of the nurses noticed a bizarre, oily sheen on Gloria's skin, like a thick film. Another caught a whiff of an odor, sharp and garlicky like ammonia or maybe a chemical solvent. Within minutes, chaos erupted in the ER. A nurse passed out and had to be carried from the room. A doctor treating Gloria began to feel faint, his face turning pale as he stumbled to a nearby sink. Another nurse doubled over with nausea, barely able to keep her eyes open. Panic spread as more staff began to collapse. Over 20 people, including doctors, nurses, and paramedics, reported symptoms. Everything from dizziness and shortness of breath to muscle spasms and convulsions. The hospital staff had faced emergencies before, but never anything like this. The ER was evacuated, and Gloria Ramirez was left in a room filled with the heavy scent of chemicals and confusion. Despite the medical team's best efforts, Gloria's condition worsened. Her heart stopped. After multiple attempts to revive her, she was pronounced dead at 8:50 p.m. But her death was only the beginning of the mystery. As word of the mass illness spread, the hospital called in hazardous materials teams, fearing a toxic spill or chemical exposure. Yet nothing obvious was found. Gloria's body was bagged and sealed, and the coroner's office took every precaution to avoid contamination. Rumors spread quickly. Was there a chemical leak in the hospital? Could she have been poisoned before she arrived? Or was something more sinister at play? As investigators pieced together the puzzle, they turned to Gloria's medical history. She had been diagnosed with cervical cancer just 6 weeks earlier. Desperate to ease her pain, it was rumored she might have turned to alternative remedies, specifically dimethyl sulfoxide, or DMSO. This compound is a solvent that some people used as a topical pain reliever, though it's not approved for medical use in the US. Here's where the science takes a strange turn. Some chemists suggested that if Gloria had applied DMSO gel to her skin to ease her pain, her body might have absorbed it. When the hospital staff administered oxygen, it's possible, though never proven, that a chemical reaction occurred in her bloodstream, converting the DMSO into a more dangerous substance. Dimethyl sulfate, a highly toxic gas. Dimethyl sulfate can cause severe respiratory distress, convulsions, and even death. If it had formed inside Gloria's body, then released during treatment, it might have poisoned the staff around her. But the story isn't that simple. Many scientists disputed this explanation, arguing that the conditions needed for DMSO to convert into dimethyl sulfate simply didn't exist in a hospital setting. They pointed out that only some staff were affected, while others who were equally close to Gloria experienced nothing at all. Others proposed an entirely different explanation: mass psychogenic illness or mass hysteria. In high-stress situations, especially in medical environments where panic can spread quickly, the brain can trick the body into producing real symptoms: dizziness, nausea, fainting, even when no physical toxin is present. Could the strange odor and fear of contamination have triggered a chain reaction of panic among the staff? Yet even this theory doesn't explain everything. Some staff members developed severe symptoms, including chemical burns on their skin and lung damage that lasted for months. One nurse was hospitalized in intensive care. Those effects are difficult to attribute to stress alone. Investigators were stuck between conflicting theories. The DMSO theory was ultimately cited as the most likely cause, but even today, it remains controversial. No definitive proof ever confirmed exactly how, or if, DMSO turned into a killer chemical inside Gloria's body. Meanwhile, Gloria's family was left in shock and grief. To them, Gloria was more than the toxic lady label the media gave her. She was a mother, a sister, and a friend, fighting a disease that had already stolen so much from her. Her family insisted she had never used DMSO, and they felt that the theories overshadowed the fact that Gloria was a person, not just a medical mystery. After Gloria's death, her body was sealed in a special casket and buried to prevent any further risk of contamination. Some staff members returned to work, but others carried the trauma of that night for years. The hospital itself changed some of its emergency procedures, but the unsettling memory of that evening still lingers in Riverside's medical community. The case of Gloria Ramirez, the toxic lady, remains one of the most perplexing incidents in modern medical history. It's a story that highlights the complex relationship between science and mystery, between fear and fact. Was it a tragic accident of chemical reactions inside her body? A case of mass hysteria? Or something else entirely? The answer may never be known. But one thing is certain: the human body still holds secrets that can shock and confound us, even in the most advanced medical settings. If you found this story as chilling and fascinating as we did, don't forget to subscribe. See you next time.